to my spectacles, but never mind. Okay. Hello, Assalamu alaikum. My full name is Siti Nur Amira Hanani binti Anwar. You can just call me Hanani. My matric number is 274049, and I will be presenting a few of the outlines of Chapter 1. So let's start off with the developments before Industrial Revolution. So one must understand the past, and by understanding the past, it can help safety and health examine the present and future with a sense of perspective and continuity. So modern developments of health and safety are neither isolated nor it is independent. Rather, they are a part of a long continuum of developments in the safety and health movement. So the continuum begins with the days of the ancient Babylonians. During that time, their ruler Hammurabi developed his codes of Hammurabi. So the code encompasses all the laws of the land at the time, and it showed Hammurabi to be a just ruler, apparently. And it sets a precedent followed by other Mesopotamian kings. So the significance of the code from the perspective of safety and health is that it contains clauses dealing with injuries, allowable fees for physicians, and monetary damage assessed against those who injured others. So this clause from the code, it illustrates Hammurabi's concern for the proper handling of injuries, as said, if a man has caused the loss of a gentleman's eye, his own eye shall be caused to be lost. Yes, that's what it said on the slide. So this movement then continued and emerges in the later Egyptian civilization, so as evidence from the temples and pyramids that still remained. The Egyptians were very much the industrious people. So found out that although much of the labor was provided by slave, there is a ample evidence that that the slaves were not treated well. They were not treated well, and that is unless it suited the needs of the Egyptian taskmasters. So next, I'll go with this. Okay, one such case occurred during the reign of Ramesses II, who undertook a major construction project, the Ramesseum. Okay, it was to ensure the maintenance of workforce sufficient to build his huge temple bearing his name. So Ramesses created an industrial medical service to care for the workers. They were required to bathe daily in the Nile River and were given regular medical examination. Okay. And sick workers were also isolated. So as civilization progressed, so did safety and health development. In 1567, Philippus Aurelius, I think that's how you're supposed to pronounce his name. So he produced a treatise on the pulmonary disease of miners. So it tilted on the miners' sickness and other miners' disease. The treaty covered disease of smeltered workers and disease associated with handling of and exposure of mercury. 1 second. Okay, around the same time, George's Argicolo, I'm sorry, I'm very bad at pronouncing the names. George's Argicolo, he published his treaty, the Re Metallica, emphasizing the need of ventilation in mines, and illustrates various devices that could be used to introduce fresh air into mines. Then moving on with Bernardino Remesny, I think that's how it's supposed to be pronounced, Remesny. The 18th century saw the contributions of Bernardino Remesny, who wrote Discourse on the Disease of Workers. So Remesny drew conclusive parallel between disease suffered by workers and their occupation. So he managed to relate occupational disease to the handling of harmful materials and to irregular or unnatural movement of the body. So much of what Remesny wrote, it is still very relevant even to this day. Move on with this next one. Okay. Just as the United States traces its root to Great Britain, the safety movement in the country traces its root to England. So during the Industrial Revolution, at that time, young child labor in factories were very common, apparently. The hours were long, the work was hard, and the conditions were often unhealthy and unsafe. Then, following an outbreak of fever among the children working in their cotton mills, the people of Manchester, England, began demanding better working conditions in the factories. So, public pressure eventually forced government to respond, and in 1802, the Health and Moral of Apprentice Act was passed. So this was considered a milestone piece of legislation because it marks the very beginning of governmental involvement in workplace safety. So it's very memorable. So following the Civil War, the seeds of safety movement were sown in the U.S. country. Factory inspection was introduced in Massachusetts in 1867. So while in 1868, the first barrier safeguard was patented. In 1869, the Pennsylvania legislature passed a mine safety law required 2 exits from all the mines. So the Bureau of Labor Statistics was established in 1869 to study industrial accidents and report any pertinent information about those accidents. Next, in 1892, the first recorded safety program was established in Joliet, Illinois. So the steel plant, in response to a scared cause when flywheel exploded. So following the explosion, a community of managers was formed to investigate and make recommendations to the communities. So the community recommendation was used as the basis of the development of safety program that is considered to be the first safety program in American industry. So around the 1900s, Frederick Taylor began studying efficiency in manufacturing. His purpose was to identify the impact of many various factors on efficiency, productivity, and profitability. Although safety was not a major focus of his work, Taylor did draw connection between lost personal time and management policies and procedures. So this connection between safety and management represent a major step towards broad-based safety consciousness. In 1907, the U.S. Department of the Interior created the Bureau of Mines to investigate accidents, examine health hazard, and make recommendations for improvement. So mining workers definitely welcome this development, since more than, apparently I didn't really wrote the exact number of deaths, but it was over 3,000 of their fellow workers were killed in mining accident in 1907. So one of the most important developments in the history of the safety movement occurred in 1908, when an early form of workers' compensation was then introduced in the United States. So workers' compensation I'm sorry. Okay. Workers' compensation as a concept made a great strides in the United States when Wisconsin passed the first effective workers' compensation law in 1911. I lost my voice. Next is the National Council of Industrial Safety, which is an abbreviation for NCIS. NCIS was established in Chicago in 1915, and this organization later changed its name to National Safety Council, and it is now the premier safety organization in the United States. They were the primary reason passage of Occupational Safety and Health Act of 1970 and the Federal Mine Safety Act of 1977. These federal laws, particularly the OSHA Act, represent the most significant legislation to date in the history of safety movement. And so, during the 1990s, the concept of total safety management, TSM, abbreviation for TSM, was then introduced and adopted by firms that were already practicing total quality management. So TSM encouraged organizations to take holistic approach to safety management, in which the safety of employees, processes, and product is considered when establishing safe and health work practice. Okay, that is all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. I'm Nur KhieraNani binti Abdul Ghani. My metric number is 272381. So we go through the next slide, which is notable tragedy. Okay, we can see here the Gully Bridge Hawk's Nest Tunnel disaster. Okay, this is the Gully Mountain from high silica content, and the construction is the Hawk's Nest tunnels. The workers work 10 hours per day breathing silica dust generated from drilling and blasting. So the workers will get the disease silicosis, the name of disease itself. The disease is 10 to 30 years unnoticeable, and occupational safety and health change disease. This is a very from my opinion, it's a very worse disease for the workers. Besides that, the workers need to work more than the hours that they should be. Okay, so from you can see from the slide is aftermath. 1. Solidified public opinion protecting workers from silicosis. 2nd, Gully Bridge disaster entitled Hawk's Nest by Herbert Skidmore created public outcry, which led to the U.S. Department of Labor to make silicosis compensable disease under workers' compensation. Okay, number 3, till today, silicosis is still a problem. Okay, whenever the workers do the construction at the mountain, mostly of the workers will get this worst disease, what we call silicosis disease. This is a very big problem to workers who are under construction. Okay, next, I'm going to show you the silicosis lung disease caused by breathing small pieces of sand or rock called silica. The silica itself, when the workers breathing while working during their working hours, the pieces of sand and rock from the mountain will get in and then get into their lung, right? So that makes maybe the piece of sand blocked their lung and make the workers itself very hard to breathe. All right. Okay. We got here 3 types: chronic, accelerate, and acute. Okay. First, I will go to the small one first. We go to the acute. Acute will go to weeks to 5 years. Okay, and the silica is highest level. Okay, number 2 is accelerated. Time after 5 to 10 years. The piece of sand or rock is higher level than the acute one. Okay, so we go to the highest level of type is chronic. Chronic is time after exposure 10 years. In 10 years, they will get the chronic exposure from the silicosis. So the silica is the lower level, but it will make a long-term disease for the workers itself. Right. So we go to the next slide, which is asbestos menace. Okay. We can see here Dr. Irving J. Selikoff, 1964, told the biological effects of asbestos that this widely used material was killing workers. Alright, these things will harm the workers itself when they are during their working hours at the construction. Okay, this is one of the effects from the piece of rock or piece of sand that get into their lung, right? And then they got their lung disease, and then they have a very hard to breathe, right? Okay. First, link asbestos to lung cancer and respiratory disease. As I have been told you, the workers will get the lung disease, such as lung cancer, respiratory disease, hard to breathe. Alright. At the time of silica finding, asbestos itself was used in homes, schools, office, factories, ships, and even the filters of cigarettes. So, someone who smoking the cigarette, you better watch out, because maybe you will get the lung cancer. Not maybe, but I'm pretty sure that you will get the lung cancer. Right. In the 1970s and 1980s, asbestos became a controlled material. Alright, and the regulation governing the use of asbestos were developed. Okay, so we go to the next slide. Bhopal gas strategy. What is Bhopal gas strategy? Okay, the Bhopal gas tragedy held on 3rd December 1984. Okay, 3rd December 1984. Okay, over 40 tons of methyl isocyanate (MIC), including hydrogen cyanide, leaked. Okay, this is what we have watched. We already watched the video that Tok Wan sent to us. It is about the MIC from the factory. Okay, everyone know, right? The MIC from the factory itself, when the pipe, maybe pipe is leaked. Okay, and it killed 3,000 people in aftermath, and 500,000 people affected. Okay. Then the protective equipment was not in full working order. Okay. As we all know that everything that we do, we need to make it perfect, and we need to make it full working, which is if in case that the equipment itself is malfunction, maybe malfunction, and it will affect all the circulation of the workers that works in that place. Okay, why Bhopal gas tragedy happened? Okay, the refrigeration system that could have cooled the storage tank was shut down. This is worse. The scrubbing system that could have absorbed the vapor was not immediately available, and the flash system that would have burned any vapor that got past the scrubbing system was out of order. So we go to the aftermath. Union Carbide. Maybe I'm sorry if I'm bad in pronunciating this name, maybe. Alright. Okay, Union Carbide. Alright. The owner of the chemical plant was accused of many things, including criminal negligence, corporate prejudice. What is corporate prejudice? Corporate prejudice is the location of factory as a poverty-stricken area, and safety was not taken into consideration. Okay, this company, this factory is not very taking well care of the safety of the working area. Alright. Okay, then avoidance. What is avoidance? Avoidance, putting the plant in India to avoid stricter safety and health standard in United States and OSHA. OSHA is Occupational Safety and Health. Okay, then we go to the next slide, which is role of organized labor. So here we see the role of organized labor. Okay. The fellow servant rule. Employers were not liable for workplace injuries that result from negligence of other employees. And then the doctrine of contributory negligence. If the action of employees contribute to their own injuries, the employer was absolved of any liability. And then the concept of assumption of risk was based on the theory that people who accept a job assume the risk that go with it. No, actually, the risk is based on the factory, based on the place of working itself. It is not. In my opinion, it is not a very good safety and health to workers if the company itself was not taking full care, or I say taking care of the welfare, safety, works, and health works of the workers. Alright. Employees who work voluntarily should accept the consequences of their action on the job rather than blame the employer. This is the problems of the most of the company lah. Okay, so we go to the next slide. Role of specific health problem. It creates public awareness of dangerous and healthy working conditions, which is legislation, regulation, better work procedures, better working conditions. As example, frequent contact with coal dust led to anthracnosis, also known as black spot. And second example is coal workers pneumoconiosis. Okay, I'm sorry if I'm wrong in pronouncing CWP, coal workers pneumoconiosis. Coal workers pneumoconiosis and compensable disease in 1934, and coal miners act passed US in 1965. Next, the Gully Bridge disaster. This is the case that I've been told you in the first of my video. Alright, the Gully Bridge disaster, the silicosis. Okay, so this disaster I don't need to explain anymore because I've explained earlier. And we go to asbestos usage. Asbestos usage also I've explained in the previous. Training and personal protective equipment. Okay. Mercury poisoning, Minamata disease, eating polluted fish. Okay, when the factory blow out the mercury, the chemical, and then the fish are poisoned. Fish are poisoned, and then the workers in the working area take the fish, maybe also the villagers, also the not the employees one. It will affect it to all in the place. Alright, it is called the Minamata disease, the mercury poisoning. Alright, and then development of accident prevention program. Okay, the 3 E's of safety improvement method. First, engineering. Right. Can I speak in Malay? Okay. Engineering is kejuruteraan. Okay. Yang kedua is education. Education is pendidikan. Third is enforcement. Enforcement is penguatkuasaan. Okay. These 3 is the safety 3 E's. Okay. And then we go to the safety and health movement today. Okay. Safety and health movement today. We need to be comprehensive. We need to have development, the rapid growth in the profession, and then safety health evolution in Malaysia. Okay. Previously, there is no compressor system act or regulation, but boiler enactment. First in Selangor in 1896. Second, Perak, 1903. Third in Johor, 1937, the boiler enactment. Okay. Second is Factory and Machinery Act 1967. This is the evolution in Malaysia that safety and health made for improvement of the workers itself, and also for the company, or maybe I can say the industrial. We go for the factories, we go to the industry company, we go to the industry. And then, okay, this is the acts that safety and health have. Okay. First, Occupational Safety and Health Act 1994 at 514, and then the Department of Occupational Safety and Health, DOSH. Then in DOSH we got National Institute of Occupational Safety and Health, NIOSH, the Malaysian Society of Occupational Safety and Health, MSOH, and then the National Security Council, BKN. BKN ni mungkin dalam bahasa Melayu. Okay. So this is the last slide. If you can see from the last slide, it said 10 works days without an accident. Alright. My question for you is, do you think that if the employees works 10 hours, 10 works day, it will not having, as what we can see in our daily routine, we also get into an accident, such as terjatuh, terpeleot, terseliuh, macam tu. So this is my question for you to answer. Do you confirm that our daily working days will not have an accident? Okay, thank you. That's all. Assalamualaikum warahmatullahi wabarakatuh.